Hello, everyone. My name is Erin Tesh, and I'm Managing Director of TSG Consulting in North America. It's so nice to be here with you today as sponsor of the 13th Antimicrobial Conference. TSG has been a proud member and partner to the three conference organizing trade associations for many years. Before we start today's session, that my colleague Abigail Wutzik will moderate, I wanted to share with you some of the results of a consumer study that TSG has recently undertaken as it relates to antimicrobial products. It probably doesn't come as a surprise to you that 79% of adults have purchased at least one household antimicrobial or protective product for personal use in response to COVID-19. However, what do consumers want from biocidal products, and do they have confidence in product claims? Over the next few minutes, I will share a few findings from our consumer survey, which was conducted in late December and early January. We questioned almost 9,000 adults in the US, Canada, UK, Germany, France, and Spain about their purchase behavior in relation to hand sanitizers and antimicrobial consumer products. We wanted to know the key factors driving the purchase of these products during the coronavirus pandemic. Our goal was to understand what do consumers want from these products. We wanted to know their thoughts around scientific evidence and efficacy claims, as well as measure trust in the claims made on the products. While the high number of people purchasing antimicrobial products isn't surprising, what might be is that our survey found that 67% of consumers find it difficult to find evidence on packaging or in product descriptions to determine whether claims are credible. 72% find antimicrobial and/or antiviral claims are often unclear, and 81% would like data substantiating claims to be more accessible. While the regulations across North America, the UK, and Europe might be complex, it is possible to develop and convey product information that engages and influences consumers while satisfying regulatory needs across multiple countries and states. After all, 73% of adults rely on labels or online descriptions to find products that are effective, and 35% of adults say scientific evidence of effectiveness impacts their purchase decisions. At TSG, our scientific and regulatory experts can work with you to strike a balance between regulatory requirements and consumer expectations. We can help you to leverage antimicrobial claims, factoring key considerations into your product development and marketing strategies, from permissible claims and terminology to active substance requirements. We can guide you through harmonizing compliance strategies across multiple jurisdictions and states. For those of you that are unaware of TSG, we've been providing companies around the world with regulatory and technical guidance for over 30 years. We help clients address technical regulatory issues associated with getting their products to market in multiple jurisdictions, as well as helping them to understand their compliance obligations. TSG is part of Science Group, which is listed on the London Stock Exchange. Science Group has offerings in three core areas: strategic consulting, product development, and regulatory support. We serve a number of key markets and industry sectors, including agricultural, industrial, consumer, food and beverage, animal health, and medical. Our teams are comprised of scientists, engineers, and regulatory experts, many of whom have held previous positions at regulatory agencies. The Science Group family has over 500 staff members around the globe. We speak more than 30 different languages, have 12 offices across North America, UK, and Europe. We also have 2 dedicated R&D facilities in the UK. So as we wrap up, if you like what you've heard today and would like to see more on our consumer research in full, please email us at info@tsgconsulting.com and we'll send you the 2 reports as soon as they become available in the next few weeks. Thank you for listening, and I hope you enjoy the rest of the 13th Antimicrobial Conference.